if you're in Brooklyn. And we are part of New York City if you're from Buffalo. So that gives us a special consideration. We need a serious reality check. We're looking at what proposes to be a budget, but it's really an ideological statement. And it's not a document that you can govern and work with people on. I'm only 6 months here in this chamber. My colleagues, almost all of them, have much more experience than I do here. But for 7 years, I ran Westchester County government. It's one of the largest governments in the state as a large county. And when you govern, you have the responsibility for an end result, not just for rhetoric, not just for words that might capture you votes or polling data. What's in this budget is going to make it impossible for mayors, supervisors, county executives, and if you want to look nationwide, governors of states to govern, to actually deliver the services that people want. When we talk about the health care impacts of this, and my colleagues have spoken about it already, my friend Adriano Espiat is going to talk a little bit more about a topic I'm touching on, the federally qualified health centers. You're looking at a real world where if we don't have health care ability for people to afford it, what do? Do they lie in the streets? Do we have to house them as homeless and unable to help them solve their problems? Do they show up at the emergency room of a hospital, and does the hospital stay there? Parts of this state, Paul Tonko will talk about it. In the northern part of New York State, you have one hospital in Glen Falls, nothing nearby, and you have a federally qualified health center not far from that in Warrensburg. That's all you have. And when they talk about, well, we have to have work requirements for people taking Medicare, they're not actually on the firing lines looking at who goes into these places. In my home county, Open Door provides different locations for health assistance for those people that are indigent. 18 service sites. Some of them are in the 16th district that I represent. Some of them are in the 17th district directly north of me. I was county executive for that whole area, so I don't look at the dotted lines of a district. If something's happening in the Bronx, it's me and Richie and Adriano and Alexander that care about it, not the dotted lines that divide us. We have Open Door has 18 service sites, 60,000 total patients. 46% of them receive Medicaid benefits, and 38% of them are uninsured. This plan will reduce that ability for Medicaid to help that portion of people, will hurt some on Medicare, and will have an impact on those other in the Affordable Care Act. What do we do with those people when they need the services, management for diabetes, asthma, hypertension, immunization? It's a real-world problem on the streets, real-world problem in the subways of New York City and on the buses of Buffalo and Rochester and Albany and in Westchester County. Sun River Health Systems. It's based in Peekskill, that's in the 17th district, but it has a major operation in New Rochelle in the 16th district. Nobody thinks in terms of districts, they think in terms of services for human beings. And they don't look at this human being and try to assess what is their demographic. Are they this ethnicity or that ethnicity? They're poor, and many times working poor. People who work as janitors, they work in restaurants, they make money and they work hard. They do jobs that other people wouldn't do, but they don't make enough in those jobs to be able to pay for the services or the medical benefits they need. Sometimes it's prescription drugs. They don't have the money for it. That's what Medicaid does. 17,000 patients in my district in Sun River, and that's the smaller portion of what Sun River does. Westchester Community Health Center, which has multiple locations across our county, and this is replicated everywhere around this state. We are all people of faith, and we have different faiths here. In my faith, there's an oft-quoted portion of Matthew 25, and it says, Lord, when did I see you hungry and gave you food to eat? When you had money for SNAP, so a Meals on Wheels program could bring food to your door. When did I see you sick and I ministered to your needs? When you had a hospital or nursing home or a federally qualified health center that could provide you that health? When did I turn my back on you, Lord? When you did it for the least of my brothers. That's what this is about. This is helping those in this society that need that help because we believe in compassion, and we believe in delivering that compassion through the tools of government. One of my colleagues has run a government. She's been town supervisor of her hometown on Long Island. And she has shown her leadership and now brought that leadership here to Washington, Congresswoman Laura Gillen of Long Island.
Well, I thank the leader for